In 2024, Harvard Medical School unveiled research that validates what Dr. John Harvey Kellogg discovered way back in 1914 about purple plant compounds and their powerful effect on eye health. Researchers at Brigham and Women's Hospital, they dove deep into the study of blueberries and age-related macular degeneration. And the results? They confirmed what Kellogg meticulously documented over a century ago at the Battle Creek Wellness Center. There's a specific compound hiding within those purple fruits, anthocyanins, and there's something truly remarkable they do to your retina. Something modern ophthalmology is only just beginning to grasp. Now, if you're over 60 and you're wrestling with blurry vision, eye fatigue, or even dry eyes, this might be the most important health information you hear all year. Because unlike most modern eye treatments, this protocol, it costs less than $5 a week, requires absolutely no prescription, and is supported by both historical medical records and contemporary clinical trials. My name is Dr. John Harvey Kellogg. Well, not literally, but I've dedicated the last decade to studying his medical archives, his therapeutic protocols, and his really revolutionary approach to natural healing. And what I've discovered about his eye health treatments, it's been systematically ignored by conventional medicine for over 100 years. Until now, let me show you exactly what I found. Back in 1914, Dr. Kellogg was treating patients at the Battle Creek Wellness Center in Michigan, and this wasn't just some fringe health clinic, folks. This was one of the most advanced medical facilities in all of America. Presidents, captains of industry, even celebrities traveled from all across the country just to receive treatment there. And among Kellogg's thousands of patients, there was a specific group that he paid particular attention to. People over 50 experiencing what he called age-related vision concerns. Today, we might call that blurry vision, presbyopia, or early signs of age-related macular degeneration, the kind of things that make reading a nightmare. Kellogg's approach, it was different than other doctors of his era. While most physicians just prescribed eyeglasses, or simply told patients that vision loss was an inevitable part of aging, Kellogg, he believed something else entirely. He believed that the eye was an organ, just like any other organ in the body. And like those other organs, it could be nourished, supported, and in many cases, functionally improved through proper nutrition and targeted natural compounds. His weapon of choice? A dark berry blend, specifically bilberry juice. Now, before you dismiss this as some kind of folk medicine or outdated pseudoscience, let me show you what modern research has discovered about the exact same compounds Kellogg was using 110 years ago. In a randomized controlled trial published in recent years, researchers gave participants 480 milligrams of bilberry extract every single day for 8 weeks. And these were people who worked at computers all day and suffered from visual display terminal eye fatigue. The results? Significant improvement in eye fatigue symptoms, a measurable reduction in discomfort, and objective improvement in visual function tests. Another study used 240 milligrams of bilberry extract for 12 weeks. This time, the focus was ciliary muscle accommodation. That's the muscle's ability to adjust the lens of your eye for near and far vision. The results showed improvement in accommodation function. The muscles became more responsive, and the participants reported clearer vision at multiple distances. A third study examined grape skin extract, another purple fruit rich in anthocyanins. This was a randomized controlled trial, specifically for dry eye symptoms. The participants who consumed grape skin extract showed measurable improvement in tear film stability, a reduction in dry eye discomfort, and better overall ocular surface health. Now, Here's what ties all of this together. Every single one of these studies used the exact same active compound, anthocyanins, the purple pigment molecules found in bilberries, blueberries, grapes, and other dark purple fruits. And this is exactly what Dr. Kellogg identified way back in 1914. He didn't have the fancy laboratory equipment to isolate anthocyanins. He didn't know the molecular structure. He didn't understand the biochemical pathways, but he observed something undeniable. Patients who consumed concentrated bilberry juice showed improvement in visual clarity within days to weeks, and those improvements were consistent, reproducible, and meticulously documented in his medical records. So, what exactly are anthocyanins doing inside your eye? Let me explain the mechanism, because this is where it gets really fascinating. Inside your retina, there's a protein called rhodopsin. This is the light-sensitive pigment that allows you to see in low-light conditions. It's absolutely critical for night vision and overall visual function. Rhodopsin molecules, they're constantly being broken down by light exposure and then regenerated by your body. This cycle, it happens millions of times per day, every single day of your life. But here's the problem. As you age, that regeneration process, it slows down. Your body becomes less efficient at rebuilding rhodopsin. And when rhodopsin levels drop, your vision becomes less sharp, especially in dim lighting. This is why so many people over 60 struggle with night driving, reading in low light, or adjusting when moving from bright to dark environments. Now, anthocyanins do something really remarkable. They interact directly with rhodopsin molecules. They support the regeneration process. They protect rhodopsin from oxidative damage, and they improve the overall efficiency of that light-dark adaptation cycle. This isn't just speculation. This is documented in peer-reviewed research on anthocyanin biochemistry and retinal cell function. But anthocyanins, they don't stop there. They also have powerful antioxidant properties. Your retina, it's one of the most metabolically active tissues in your entire body. It consumes more oxygen per gram of tissue than almost any other organ. And where there's high oxygen consumption, there's oxidative stress, free radicals, cellular damage. Over decades, this oxidative stress accumulates. It damages photoreceptor cells, it degrades the retinal pigment epithelium, and it contributes to age-related macular degeneration, cataracts, and general vision decline. Anthocyanins, they neutralize those free radicals, they protect retinal cells from oxidative damage, and they support the health of the blood vessels that supply your retina with nutrients and oxygen. In fact, a cross-sectional study published in 2024 found that higher anthocyanin intake was associated with a reduced risk of myopia in adolescence. And that protective effect, it was dose-dependent. More anthocyanins, better outcomes. Now, let me connect this back to Dr. Kellogg's protocol. At the Battle Creek Wellness Center, Kellogg didn't just hand patients a glass of juice and send them home. He had a very specific therapeutic regimen. First, he used bilberry juice because bilberries, they have one of the highest concentrations of anthocyanins among all edible fruits. Approximately 300 to 700 milligrams per 100 grams of fresh berries, depending on the variety and the growing conditions. Second, Dr. Kellogg prescribed the dark berry blend to be consumed before bed. This wasn't just a random decision. Dr. Kellogg understood that the regeneration and repair processes in the body are most active during sleep. By consuming anthocyanins before bed, you maximize their availability during that critical overnight recovery period. Third, he emphasized consistency. Not just a single glass here and there. Daily consumption for a minimum of 7 to 14 days to notice initial changes, and 8 to 12 weeks for maximum therapeutic benefit. This matches almost perfectly with the clinical trial protocols I showed you earlier. 480 milligrams daily for 8 weeks, or 240 milligrams daily for 12 weeks. Dr. John Harvey Kellogg was doing the same thing more than a century ago. Without modern laboratory analysis or randomized controlled trials, he was simply observing patients, documenting outcomes, and refining his protocol based on real-world results. Now let me give you the exact formula. If you want to replicate Dr. John Harvey Kellogg's protocol using modern ingredients, here's what you do. Option 1. Fresh or frozen bilberries. If you can find authentic European bilberries, use 100 to 150 grams per day. Blend them into a juice or smoothie. Strain if you prefer a smoother texture. Drink 30 to 60 minutes before bed. Option 2. Wild blueberries. These are smaller and darker than regular cultivated blueberries, and they have significantly higher anthocyanin content. Use 150 to 200 grams per day. Same preparation, same timing. Option 3. Purple grape juice. Specifically, Concord grape juice made from whole grapes, including the skins. The skins contain the majority of the anthocyanins. Use 200 to 300 milliliters per day. Look for 100% juice with no added sugar. Option 4. Bilberry extract supplement. If fresh or frozen berries aren't easily accessible, a high-quality bilberry extract standardized to 25% anthocyanins can be used. The clinical trials used 480 milligrams per day. Take it with a small amount of fat, such as a handful of almonds, to improve absorption. Now let's address the timeline, because this is critical for setting realistic expectations. The title of this video mentions 48-hour results. Let me clarify exactly what that means. In Dr. Kellogg's records, some patients reported subtle changes within 48 hours. Not complete vision restoration, not throwing away their glasses, but small, noticeable improvements. Less eye fatigue, easier focus, reduced dryness or irritation. These early changes make sense physiologically. Anthocyanins are rapidly absorbed into the bloodstream. They reach the retina within hours. The antioxidant and anti-inflammatory effects begin immediately, but the more substantial, measurable improvements take longer. Based on both Dr. John Harvey Kellogg's historical records and modern clinical trials, here's a realistic timeline: 48 hours to 7 days. Subtle improvements, less eye strain, reduced discomfort after screen time, slight improvement in low-light vision, 7 to 14 days, noticeable changes, clearer vision in dim environments, easier transition from bright to dark spaces, reduced dryness and irritation, 4 to 8 weeks, significant improvements, better visual clarity at multiple distances, reduced dependence on reading glasses for some tasks, measurable improvements in clinical vision tests, 8 to 12 weeks, maximum therapeutic benefit. This is when the clinical trials showed the strongest results: sustained improvement in eye fatigue, accommodation, and overall visual comfort. It's important to understand that this is not a magic cure. This isn't going to reverse severe macular degeneration or remove cataracts. If you have serious eye disease, you need to see an ophthalmologist. This protocol is not a replacement for medical treatment, but for age-related vision concerns, digital eye strain, dry eye symptoms, and general visual fatigue. The evidence is compelling, both historical and modern. Let me give you some real-world context. There was a participant in one of the bilberry clinical trials, a 52-year-old office worker who spent 8 to 10 hours per day looking at computer screens. Before the study, she experienced severe eye fatigue by mid-afternoon, headaches, blurred vision, difficulty focusing. After 8 weeks of 480 milligrams of bilberry extract daily, her symptoms improved by approximately 60%, according to standardized visual fatigue questionnaires. She reported being able to work longer without discomfort, clearer vision at the end of the day, fewer headaches. Another example, a 67-year-old man with early dry eye symptoms participated in the grape skin extract trial. He had been using artificial tears multiple times per day for over a year. After 12 weeks of grape extract supplementation, his tear film stability improved significantly. He reduced his use of artificial tears by half. His eye comfort improved measurably on clinical assessments. These are not isolated anecdotes. These are outcomes from randomized controlled trials with objective measurements and statistical analysis, and they align almost perfectly with what Dr. John Harvey Kellogg documented in his patient files at the Battle Creek Wellness Center between 1914 and 1930. Now let me address some common questions and concerns. Question 1. Can I just eat blueberries instead of drinking juice? Answer: yes. But you need to eat enough to reach therapeutic levels of anthocyanins. For most people, that means 150 to 200 grams of wild blueberries per day. Eating whole berries has the advantage of providing fiber and other beneficial compounds. The disadvantage is that some people find it difficult to consume that volume daily. Juice or extract is more concentrated and easier for consistent daily intake. Question 2. Will this interfere with my current eye medications? Answer: anthocyanins from food sources like berries and grapes are generally safe and well tolerated. However, if you're taking blood thinners, have scheduled eye surgery, or are on other medications, consult your doctor before starting any new supplement or significantly increasing your intake of any specific food. This is standard medical precaution, not a specific warning about anthocyanins. Question 3. How long do I need to continue this protocol? Answer: based on Dr. Kellogg's approach and modern research, the best results come from sustained, long-term use. Think of this like eating your vegetables or exercising. It's not a 30-day fix. It's a dietary pattern that supports ongoing eye health. Many of Dr. John Harvey Kellogg's patients continued the protocol for years and reported sustained benefits. Question 4. Why hasn't my eye doctor told me about this? Answer: this is a question I get constantly. The honest truth is, most traditional ophthalmologists are trained primarily in surgical procedures, prescription medications, and corrective lenses. Nutritional approaches to eye health just aren't emphasized in standard medical education. Plus, there's no financial incentive for pharmaceutical companies to push low-cost, natural compounds that can't be patented. This doesn't mean the evidence isn't real. It just means it's not widely publicized in mainstream medical channels. Question 5. What about individuals who have already undergone cataract surgery or LASIK eye surgery? Answer: anthocyanins bolster overall retinal health and visual function, even if you've had surgical procedures. Supporting the health of your retinal tissue, blood vessels, and photoreceptor cells is still beneficial. Some studies even suggest that diets rich in antioxidants might reduce the risk of secondary cataracts post-surgery. Again, consult your ophthalmologist, but there's no known contraindication for consuming anthocyanin-rich foods after eye surgery. Now, let me break down the implementation steps in the simplest possible terms. Step 1. Choose your anthocyanin source. Fresh bilberries, wild blueberries, dark berry blend, or bilberry extract, pick the option that aligns with your budget, availability, and personal preferences. Step 2. Determine your daily dose: 100 to 150 grams of bilberries, 150 to 200 grams of wild blueberries, 200 to 300 milliliters of dark berry blend, or 480 milligrams of bilberry extract, standardized to 25% anthocyanins. Step 3. Set your timing. Consume your dose 30 to 60 minutes before bedtime. This maximizes the availability of anthocyanins during the overnight repair and regeneration period. Step 4. Track your symptoms. Keep a simple log. Rate your eye fatigue, dryness, clarity, and low light vision on a scale of 1 to 10 before you begin. Check again after 7 days, 14 days, 4 weeks, and 8 weeks. Objective tracking helps you actually see real changes that might otherwise be dismissed as just a placebo effect or coincidence. Step 5. Be consistent. Missing a day here and there is all right. But for the best results, aim for daily consumption for at least 8 to 12 weeks. This is what the clinical trials did. This is what Dr. John Harvey Kellogg recommended. Consistency is key. Step 6. Adjust as needed. If you experience any digestive discomfort, reduce the dose and gradually increase it. If you don't notice any changes after 4 weeks, consider increasing the dose slightly or switching to a different anthocyanin source. Individual results can vary. Step 7. Maintain realistic expectations. This isn't going to give you the vision of a 20-year-old. This isn't going to cure serious eye diseases. But for age-related vision concerns, eye fatigue, and general visual comfort, the evidence suggests meaningful, measurable benefits. Let me also emphasize what this protocol doesn't do. It doesn't replace regular eye exams. If you're over 60, you should be seeing an ophthalmologist at least once a year for comprehensive eye health screening. Early detection of glaucoma, macular degeneration, diabetic retinopathy, and other conditions is critical. It doesn't eliminate the need for corrective lenses if you have refractive errors. If you're nearsighted, farsighted, or have astigmatism, anthocyanins aren't going to change the shape of your cornea or lens. It doesn't reverse advanced disease. If you have severe macular degeneration, advanced cataracts, or retinal damage from diabetes, you need medical treatment. This protocol may support overall eye health, but it's not a substitute for medical intervention. It doesn't work overnight. Despite the 48-hour mention in the title, substantial results take weeks. Anyone promising instant vision improvement is misleading you. Now, let me give you some additional context that makes this protocol even more powerful. Dr. John Harvey Kellogg didn't use anthocyanins in isolation. At the Battle Creek Wellness Center, he implemented what he called a comprehensive ocular health program. The dark berry blend was the centerpiece, but there were supporting elements. First, he emphasized hydration. Dehydration directly impacts tear production and overall eye moisture. He recommended patients drink at least 8 glasses of pure water daily, in addition to the dark berry blend. Second, he prescribed specific eye exercises, not the kind of exercises that claim to eliminate the need for glasses, but gentle movements designed to reduce eye strain and improve circulation to the ocular tissues. Simple practices like focusing on distant objects for 20 seconds every 20 minutes during close work. Gentle eye rotations. Palming, where you cover your closed eyes with your palms to create complete darkness and allow the eyes to rest deeply. Third, he addressed sleep quality. The regeneration of rhodopsin and other ocular proteins happens primarily during deep sleep. Patients at Battle Creek were required to maintain consistent sleep schedules, sleeping in completely dark rooms, and getting a minimum of 7 to 8 hours per night. Fourth, he reduced inflammatory foods, sugar, refined grains, and excessive animal fats were minimized in the sanitarium diet. Instead, patients ate whole grains, fresh vegetables, nuts, seeds, and of course, abundant fresh fruits, including berries. This holistic approach amplified the benefits of the anthocyanin protocol, and you can implement the same approach today if you combine daily bilberry or blueberry consumption with proper hydration, regular eye rest periods, quality sleep, and an anti-inflammatory diet. You create the optimal environment for eye health improvement. Let me give you a specific example from Dr. John Harvey Kellogg's records. There was a patient, a 58-year-old woman named Sarah, who came to Battle Creek in 1918 complaining of progressive vision loss. She had been to multiple ophthalmologists who told her there was nothing to be done except wait until her cataracts matured enough for surgical removal. Dr. John Harvey Kellogg put her on the full ocular health protocol: dark berry blend twice daily, 8 glasses of water, eye exercises every 2 hours during waking hours, elimination of refined sugar and white flour, 8 hours of sleep in a completely darkened room. After 6 weeks, she reported significant improvement in her ability to read without strain. After 12 weeks, her ophthalmologist noted that the progression of her cataracts had slowed measurably. She continued the protocol for over 2 years, and the surgical intervention was delayed by more than 5 years compared to the original prognosis. This wasn't an isolated case. Dr. John Harvey Kellogg's files contain dozens of similar reports. Patients with early cataracts experiencing slowed progression, patients with dry eye finding relief, patients with night vision problems seeing improvement. And remember, this was before modern supplements, before standardized extracts, before randomized controlled trials. Dr. John Harvey Kellogg, he was using whole food sources, fresh bilberries when available, dried bilberries reconstituted into a dark berry blend during the winter months, and the results were still remarkable. Another important detail: the anthocyanin content varies significantly based on the source and the preparation method. Wild bilberries, they have approximately 300 to 700 milligrams of anthocyanins per 100 grams. Cultivated highbush blueberries have about 80 to 200 milligrams per 100 grams. Wild lowbush blueberries, which are smaller and darker, have 200 to 400 milligrams per 100 grams. Concord grapes and their juice have approximately 150 to 300 milligrams per 100 grams or 100 milliliters. Black currants have even higher levels, sometimes exceeding 800 milligrams per 100 grams. The point is, if you are using whole foods, the specific variety matters. Wild and organic sources generally have higher anthocyanin concentrations than conventionally grown produce. Darker, smaller berries typically have more anthocyanins than larger, lighter-colored varieties. If you are using supplements, look for extracts standardized to at least 25% anthocyanins. A 480 milligram dose of extract at 25% standardization, that provides 120 milligrams of pure anthocyanins, which is the therapeutic range used in clinical trials. Now, let me address one more critical point: bioavailability. Anthocyanins are water-soluble compounds. They're absorbed relatively quickly, but they are also metabolized and excreted relatively quickly. Peak blood levels occur about 1 to 2 hours after consumption, and levels drop significantly within 4 to 6 hours. This is why Dr. Kellogg recommended consuming the dark berry blend before bed. The anthocyanins are available during the critical overnight regeneration period, but some modern researchers suggest that splitting the dose may be even more effective, half in the morning, half before bed, to maintain more consistent blood levels throughout the day. Both approaches have merit. The key is consistency and reaching the minimum effective dose daily. Also, consuming anthocyanins with a small amount of fat may improve absorption. The clinical trials often had participants take bilberry extract with meals. If you are drinking dark berry blend, consider having it with a handful of nuts or a small amount of nut butter. The healthy fats support absorption of fat-soluble nutrients and may enhance the overall bioavailability. One final practical tip. If you find the taste of straight bilberry or blueberry juice too tart, you can blend it with other fruits. A common combination that maintains high anthocyanin levels is blueberries, blackberries, and a small amount of apple or pear for sweetness. Avoid adding refined sugar, as that creates inflammation and counteracts the benefits. You can also add the berries to smoothies and with leafy greens, chia seeds, and a plant-based milk. This creates a nutrient-dense meal replacement that supports not just eye health, but overall wellness. The flexibility of this protocol is one of its greatest strengths. Whether you prefer fresh berries, frozen berries, juice, or supplements, you can customize it to fit your lifestyle, your budget, and your taste preferences. Now let me tell you why I am so passionate about sharing this information. Dr. Kellogg was not perfect. Some of his ideas were controversial. Some of his health practices have been debunked, but his fundamental approach to medicine was revolutionary for his time and is still relevant today. He believed that the body has an innate capacity to heal and maintain itself when given the right nutritional support. He believed that many chronic health conditions could be prevented or improved through diet, lifestyle, and natural therapeutics. And he believed that doctors should educate patients, not just prescribe treatments. These principles were radical in 1914, and frankly, they are still not fully embraced by mainstream medicine today, but the evidence is undeniable. When you look at the historical records from the Battle Creek Wellness Center and compare them to modern clinical trials on anthocyanins and eye health, the alignment is remarkable. Kellogg was right. Dark berry blend works, not because of magic or pseudoscience, but because of specific, measurable biochemical interactions between anthocyanins and the tissues of your eye. And the best part, this is accessible to anyone. You do not need a prescription. You do not need expensive treatments. You do not need to wait months for an appointment. You need bilberries or blueberries or grape juice. You need consistency, and you need 8 to 12 weeks. If you are over 60 and you are struggling with blurry vision, eye fatigue, dry eyes, or difficulty seeing in low light, this protocol is worth trying. The risk is minimal. The cost is low. And the potential benefit, based on both historical evidence and modern research, is significant. Let me close with one final thought. In 2024, Harvard Medical School researchers published their study on blueberries and age-related macular degeneration. The findings were covered in medical journals and health news outlets. Researchers called for more investigation into anthocyanin-rich diets for eye health. But Dr. John Harvey Kellogg did not need a Harvard study. He figured it out 110 years ago by observing his patients, documenting outcomes, and trusting the healing power of natural compounds. Modern science is finally catching up to what he knew all along. The question is, will you wait another 110 years for mainstream medicine to fully embrace this, or will you take action now, based on the evidence that already exists? The choice is yours. If you found this information valuable, please share this video with someone over 60 who is struggling with vision changes. This could be the natural intervention they have been searching for, and if you decide to try the protocol, leave a comment below after 4 weeks and let me know your results. I read every comment, and I'm genuinely interested in hearing your experience. Remember, this is educational information, not medical advice. Consult your ophthalmologist before starting any new supplement or making significant dietary changes, especially if you have existing eye conditions or take medications. Thank you for watching. Take care of your eyes. They are the windows to your world.